I'm sorry you haven't been feeling well since insurance denied your meds. Mason, do you just want to feel better?
In a country that spends more on healthcare than any other, you'd think everyone would have access to the best care, right? But the truth is, too many people are being denied treatment, and it costs lives. Let's watch these next few clips on how disastrous it is that one of the most financially stable countries does not provide United Healthcare.
Mason has a lot of complications from his transplant. He has graft versus host disease. So he's been on the same blood pressure regimen for 8 years. Doing great, blood pressures have been great. And then in January, they decided they were no longer going to cover one of his blood pressure medications.
We lost a 17-year-old boy. He'd been sick for a few days. He had no previous health conditions. Wednesday, he had gone to an urgent care for an HMO. He didn't have insurance, so they did not treat him. When he got to AV Hospital, they were able to revive him and keep him alive for about 6 hours. But by the time he got there, it was too late.
Middle school Caitlin C. has dreamed big. That dream to one day in some capacity be a doctor. 3 years ago, a curveball was thrown her way. She was diagnosed with an autoimmune disease that mistakenly attacks cells called platelets. Just had one more option, a pill called Promecta that could once and for all stabilize this issue until she got to the pharmacy.
This medication's gonna cost you over $8,000.
Something C says she can't afford to pay every month simply to live.
They have about 1 out of every 7 claims is denied, and only 0.1% of denials gets appealed, because when you look at the appeal process in the Obamacare thing, it's almost impossible to go through. So people wind up either leaving a facility before they should, or somehow mortgaging their home to pay for what the denial was supposed to pay for.
We surveyed nearly 1,495 people who had real health problems, multiple hospitalizations and doctor's visits, and often many other needs besides. And some of what we found was pretty disappointing. Patients said they were receiving care that was confusing, conflicting, dispiriting, and included medical errors. They also reported substantial financial distress despite health insurance coverage that was supposed to protect them.
Earlier this fall, United Healthcare was the subject of a Senate probe into insurance companies intentionally denying people's claims for profit.
Industry where when your customer uses your service, you lose money. And so there is an inherent profit motivation to avoid paying claims. And the best ways to do that are delay, deny, and then defend your position on why the denial occurred.
You know, if an insurance claim gets denied, people can appeal, but that can be a long and complicated process. One mom waged a year-long battle to get coverage for a procedure her son had.
He actually ended up having 6 wisdom teeth. He had 2 extra that he had to have removed because of impaction.
Jenna Poor says after her 15-year-old son's oral surgery, her health insurance company denied the claim, leaving her on the hook for almost $4,000.
Health insurance companies deny claims. An appeal is not very likely. Federal data shows that companies issued more than 49 million denials in 2021, but customers appealed only about 0.2% of them. And while some denials come with specific justifications, most explanations are vague.
Investigative journalists at the nonprofit ProPublica found that the health insurance company Cigna uses an automated system that allows it to instantly reject claims on medical grounds without even opening the customer's file. Some are accusing Cigna of using the system to help cut costs at the expense of the patients, a claim which Cigna denies.
To these 3 words, delay, deny, defend. Those words are the title of a book by Jay Feinman that describe strategies health insurance companies use to avoid paying your claims.
We as providers and patients every day are facing the challenge of the insurance companies controlling medicine. Not only do they control the delivery of care, they decide what it's worth. It's the only system I've ever heard of where the people paying the bill decide what the bill should be.